Welcome to our joint committee on child welfare and foster care and corrections and juvenile justice. Representative Owens and I got an opportunity to look at the report last week that DCF had requested from Chapin Hall, and thought that it would be valuable information for our two committees to hear before session was over, before committees ended. So we decided to put together this joint committee, and thank you all for being here. And we'll start off with representative, I did this once earlier this year. Secretary Howard, you are not a representative. Secretary Howard. Okay, it's COVID brain is what it is. That's what I'll blame anyway.
Thank you, Madam Chair and Mr. Chairman and members of both committees. I won't take a long time today because I'm really just going to set the context for kind of your main attraction, which is really going to be hearing from Dr. Heaton from Chapin Hall at the University of Chicago. But I do appreciate the chance to talk to you just for a few minutes to introduce the efforts to support and improve placement stability for children in foster care out-of-home placement. You will hear from Dr. Heaton with the Chapin Hall at the University of Chicago. We had the chance to bring in some technical assistance to the state and to support some work that we were doing with our child placement agencies and case management providers, and they provided some great technical assistance to us. And as you'll hear in her presentation, and I think as you know from earlier discussions in this joint committee earlier this session, as well as in individual hearings, the root causes of placement stability go far beyond the foster care system itself, and certainly include things such as inadequate community-based prevention services, a front door to foster care that's pretty wide in Kansas, and a lack of placements for older youth with intensive behavioral health needs. I wanted to just mention briefly some of the work we've been doing on prevention capacity, and then let you know about the work group effort that led to the report that Chair Kincannon referenced that led to this meeting today. Certainly, access to services and supports in the home communities for youth is key to well-being and key to preventing the need for foster care. We've been about a lot of efforts, DCF and our partners, in preventing the need for foster care for children, especially amplified with the launch of Family First in 2019, which really brought some important evidence-based approaches to Kansas communities in areas of parent skill building, mental health, substance use. And that's been really important to increase the continuum of services available. Additionally, much of the work that this body has done, as well as this administration, in terms of increasing the continuum of crisis services. And when we think about the community-based partners that are so critical in this conversation, you have behavioral health, you have law enforcement, you have education, you have a variety of community-based partners. We also held a number of stakeholder sessions last summer based on some legislation that was sponsored by Senator Faust-Godot last session related to performance-based contracts. There was a lot that came out of those, but I think one of the things that was most striking was how many times the conversation turned to implementing more effective community-based practices for families with children who were 12 years of age or older, just really the challenges of older youth. I wanted to just call out some data that's on the bottom of the first page of my testimony, just to set some context about older youth who come into care. Last fiscal year, we had 737 youth that were 14 and older who came into the foster care system. 40% of those were removed from their home, not for abuse or neglect, but because there was a need for services. Now, perhaps there were mental health issues going on with the child, perhaps there were behavioral needs, but again, not for abuse or neglect. And I think you've heard some of this testimony before. And a few more than half of those, 53% of those requests for petitions came not from DCF, but from the court. So we've really tried to put a lot of effort around what kinds of other supports might be out there in communities to defer the need for foster care when there is an abuse or neglect, especially with older youth. Um, there are some parent youth facilitation programs in Saline and Wyandotte counties that have been available through some federal grants that the KU School of Social Welfare had received. Again, targeted at those older youth, targeted at their parents or caregivers, resolving conflict, getting those community supports in place, and making sure that truancy doesn't result in placement in foster care. Um, the use of multi-systemic therapy, well-supported mental health evidence-based program. You know that, those of you on corrections and juvenile justice, you know how valuable that is in the juvenile justice system. We were able to launch that as well on the child welfare side with Family First. And I'm really excited to say that with the new Family First grants, the second round that we just awarded, we will have MST available across the entire state of Kansas. So again, an additional important augmentation. I mentioned just a few other things here around augmenting the use of functional family therapy, some of the impacts of the continuum of crisis services, and some work we're trying to do with Medicaid to create children's behavior interventionist services. Again, a really evidence-based, effective one-on-one support for youth and families that we're working hard to get added to the state Medicaid plan. As well as some of our intentional work around team decision making, bringing families and those close to the child to the table. And then also modeling some work after some activities in Iowa that are really designed to ask some critical questions before the decision's made to place a child in foster care, especially when there's not abuse or neglect, asking things like, what can we do to remove the danger inside of the child, et cetera, et cetera. So again, a lot of work going on in this area. Um, some of that has been concurrent with kind of the work group that you're going to hear about. But in 2019, we began what we call Leading for Results, a placement stability work group. Um, and we later on, the Center for States, which is a technical assistance arm of the Federal Children's Bureau, joined the collaboration, offering technical assistance and bringing Dr. Heaton and Chapin Hall to the table with us. They've really been able to provide a lot of technical assistance, dig deeper in the data, look at kind of root cause analysis, bring some national perspectives. But what you'll see when you hear from Dr. Heaton is really efforts over really the last 3 years of DCF and its community partners um, around the table, multiple work together, looking at approaches to improve placement stability. I've listed some of that work. For many of you, this is things you have heard before. The effort to place children with relatives at the front end of foster care. Some of our work with QRTPs, adding therapeutic foster care, and creating a network of providers to prevent failure to place instances. So again, I'm excited. You'll get to hear from Dr. Heaton and her expertise today, and um, and the summary that she'll bring of the work that that really your Kansas providers, my staff, child placement agencies, and case management providers have been doing together, since the fall of 2019 through this Leading for Results effort. So again, I'm happy to answer questions later, but I want to make sure I know with your reduced time that you have a chance to hear from Dr. Heaton.
Okay. Thank you, Secretary Hart. All right. Without any further ado, I think we'll turn it over to Dr. Heaton, who's joining us via WebEx.
Hi, good afternoon. Can you hear me okay?
Yes.
Okay, thank you. Thank you so much for that introduction, Secretary Howard. And I want to thank the members of this committee, as well as Chairwoman Cannon and Chair Owens for inviting me to share some of the exciting work that Kansas has been doing in this space, just like Secretary Howard mentioned. I'm going to share my screen, if that's okay with folks, and make sure that you all can see it. And I want to get this from the beginning. And hope everybody can see that, the presentation today. As I mentioned, thank you for having me. My name is Dr. Leanne Heaton, and I am a center consultant with the Capacity Building Center for States. I'm also a senior researcher at Chapin Hall. And what you're seeing here on the screen is a team effort that has been taking place in Kansas, leading for results over the last few years. It's been our privilege as the center team to support the Kansas team, and you can see all of the members there that Secretary Howard just mentioned, many of whom are part of DCFS and your service providers. I also just want to highlight that this is a team also of consultants on the center side, and we are pleased to have been able to support and partner with Kansas through this journey. What I'd like to do today is start with some of our high-level findings from this work. I want to elevate those findings front and center, and then I want to walk you through the process that both Kansas and the center team took together to get to these findings. So we're going to talk a little bit about root cause analysis. I'm going to show you the theory of change right up front, and then we're going to walk backwards to how we got to where we are based on data and based on hard work in your areas, having conversations at the local level about what was going on in Kansas in placement instability. I'm then going to close out with some national trends that we've been looking at Chapin Hall that are consistent with the root cause analysis work that has been taking place in Kansas. And I also want to show you some national initiatives that you can think about and perhaps inform some of your own efforts in this space. First and foremost, what I'm showing you are the findings. So we engaged in all of this work, and I'm going to walk you through that in just a moment. And what we found is not really what we thought when we started this process. So when we think about placement stability, what we are looking for is when a child or a youth is removed or separated from their family for abuse and neglect, what we want them to do is be in foster care in a home temporarily and be stable. We know from research, when a child and youth is stable in a placement, they are more likely to reunify or go to an alternative permanent placement. What we found through the data work and through all of these conversations in the areas and at the state level is that placement instability in Kansas, one of the main drivers, it actually wasn't as much of a foster care problem as we thought. Rather, it was directly related to key points throughout the child welfare system, starting with number one, inadequate community-based prevention services to meet needs of older youth with higher levels of disability and service needs, many of them behavioral health related. And actually it was older youth, and I'm going to show you data in just a moment, that are driving a lot of the placement instability in Kansas. And some of that is due to the front door in Kansas being too wide. Secretary Howard alluded to the fact that you have some removals that are happening that are not abuse and neglect related. I'm going to talk and show you some data around that. And then thirdly, when you do have youth that come into your system, we do need to find some placements. And it's really hard for this particular age group and these particular needs to find the right kinds of placement in foster care. This next slide shows you some of the conversations, both at state level, leading for results, work group discussions, and stakeholder meetings at the areas. And they are mapped to each of the 3 root causes. And you can see some of the contributing factors that folks started listing in these meetings. Some of it was related to policy and practice. Some of it was related to community and organizational resources. Others were related to external factors. And I'm not going to read all of these to you today, but this is more of an illustration of the level of detail and work that this group has been put into this effort over the last couple of years. I'm going to now summarize our theory of change. Through this systematic, data-driven process, we got to this possible pathway of change. If older youth with intensive behavioral health needs are the main ones, they're not the only ones driving placement instability, but I'm going to show you data to illustrate that they're a big part of it. If we know that this is the case and they are coming into the system because of intensive behavioral health needs, that suggests a cross-system solution. So policies, practices, fiscal and community resources coming together, being strategically aligned across behavioral health, juvenile justice, courts, and child welfare. This seems like a challenge, but I'm going to show you today at the end of this presentation that there are actual national initiatives right now that are underway that are doing just this. If we do that, youth with intensive behavioral health needs will have the right community resources to meet their needs so that fewer youth are entering the foster care system and are stable in their communities, so that foster care is actually being used as designed as a temporary solution for severe abuse and neglect, replaced with relatives whenever possible. And if we do all of these things, the foster care system in Kansas, as well as any foster care system in the country, will able to right size and actually have the resources it needs to meet children and youth temporarily when they need it. So that's where we are. And what I'd like to do now is just spend a few minutes walking you through the data-driven process that we did in Kansas to get to this theory of change.
Dr. Heaton.
What you're looking at here.
Dr.
Yes.
Heaton, can I interrupt you
Yes.
for a minute? So
Absolutely.
The committee, part of the committee has been able to find these slides, and I can tell some have not. The PowerPoint is on the committee testimony page for today, or Representative Owens has just sent it out. The members of his committee have already had it from, they would have received an email from Colette, and the members of my committee should have an email in your inbox from Representative Owens that contains the slide presentation. So let us know if you have trouble finding it. We could see it in the beginning, but now that we're getting into some details, Dr. Heaton, we can't read the screen. So go ahead and proceed. Thank you, and sorry for the interruption.
No problem. Is the screen not available, or is it just kind of small?
It's available. It's just that the print is kind of small when the slides have a lot of writing on them.
Thank you for that. I am happy to hear that folks will have the slides available and can follow along, but I'll also try to just make sure that what I'm showing, I hit some of the highlights and some of the more fine detail folks will be able to review later. So as I mentioned, the center supported this effort. It is part of the Children's Bureau's technical assistance arm, and we follow a model. we follow a model that's based in research on change management and implementation in child welfare settings. And this particular model starts with problem exploration, bringing a team, getting folks ready to engage in a problem. And in this case, the problem was placement instability. Kansas knew it, and they really wanted to try to figure out what was behind it. And so that's what we did. In fact, a lot of the part that you see, and it may be very small, on the far right-hand side, problem exploration and theory of change, that's what we've done together with the Leading for Results team over the last year and a half. Where we are now is really at a point to select interventions, and that's where we really need the leadership of Secretary Howard, which we know is supportive, and this legislative body to kind of help push these interventions forward. And I'm going to show you why in just a moment through some of the more of this presentation. Okay, so we always start this work in the model using a data plan. And we want to base this on administrative data or quantitative data usually. And in this case, that way we can see the whole population of the children and youth that are in the foster care system in Kansas. And so we also start with research questions, grounding any kind of data work that we do. And in this case, we wanted to know who was most impacted, like what are the demographic characteristics, and then we wanted to know placement patterns. And we wanted to define placement stability in a way that is consistent with federal standards, but also in a way that Kansas was already tracking. So in this case, placement instability is any child or youth that is in a placement, moves around 3 or more times within a 12-month period. We really want them to only have 1 placement, but 2 at the max. So any child or youth that is bouncing around 3 or more placements in 12 months, that's really the problem that we were trying to dig into. And that's what we did. And then we wanted to compare these children and youth that are bouncing around or having more instability to those that weren't. And so that's what we did with this data plan. And so anytime that we start at the center or I start with a jurisdiction, I always want to look at what data are they already producing on a public website. And actually, when the center started this work, I found a number of different data reports and measures that the child welfare team in Kansas were already generating to support Leading for Results, but also just to inform the public and others. And you can see those here. And so a lot of what happens with data from a consulting perspective is I find a lot as a researcher and a data consultant that jurisdictions often have lots of data. And it's just a matter of organizing it systematically to tell a story that shows trends, and then also is set up in a way that you can understand who is being impacted. And this is very much like the public health model. If you look at public health research, you're going to see data is almost always presented by gender, by race, by age, sometimes by location. And then we're also going to look at trends because we want to understand patterns over time to make sure that we're not focused on just an anomaly. So that's what we did. Some of the key things that you'll see here on the screen is we saw in the beginning we were looking at the data that it seemed like placement instability was a little bit more common in males, but that difference isn't that much. We also noticed overrepresentation of Black children and youth in the placement instability numbers. But this is true across Kansas data. It's also true across a lot of child welfare data in numerous states. And we also wanted to call out any tribal affiliation or any American Indian and Alaska Native youth that are in your data, because we always want to be mindful of ICWA requirements and so forth. So I wanted to call those out, but then I really want to focus on the story that is in the bottom right-hand corner if you're facing the screen. And that's the age group driving placement instability. And this was a pretty consistent trend that I'm going to show you in just a minute. So 61% is this age group. That's what's driving placement instability. We see a presence of disabilities. And again, that particular measure is defined broadly and includes behavioral health, and it may include other kinds of disabilities. But in particular, we wanted to call out the behavioral health part of that measure. And then we also saw this pattern of running away. So just to put a little finer point on it, and I think hopefully this is a little easier to see, extend the slides with lots of words. This is a trend line of that age group, driving placement instability. So you can see early on in 2019 on the far left, it was about 54%, or a little over half of the age group driving placement instability. But over time, you can see those percentages increasing. And in fact, right now we're at 71% in state fiscal year 2023. And I also want to note, we're only able to present half a year's worth of data at this point from the data team in Kansas. And while I'm sharing this data, I just want you all to know that it was your child welfare data team that pulled all this data and provided it to the group. And our team just simply organized it in a way to tell the story. So the next thing that I want you all to focus on in this story of placement instability is, again, the trend line over 5 years of disability. What we saw early on in 2019 is about 39% of the placement instability population had disabilities. But over time, you can see that steadily increase to where we are in this state fiscal year. And again, we only have half a year's worth of data, but we're at 71%. So that trend has steadily increased and has spiked, at least for right now. So then what we wanted to do is look at these trends of placement, right? It's very important when you look at child welfare data to understand, where are children and youth coming, where are they placed when they immediately come in, and why they're coming in. And we got really curious about this primary reason for neglect measure. We noticed this pattern steadily increasing over a third of children and youth in placement instability being removed for non-abuse and neglect related reasons. And we heard Secretary Howard just say that a few moments ago. So Kansas knew that this was happening, right? So just to put this on a finer point, this is separating a child or youth from their family and placing them in a foster care system that's meant to be a temporary refuge for abuse and neglect. So you can kind of see the mismatch here. We also know that this placement instability group, they tended not to go with relatives, although that has increased a little bit. But when you compare them to the group that's really stable, that group is using relatives at a much higher percentage. About a quarter go directly into residential and group care, and only about half are placed with family foster care. Okay, so again, I just wanted to show you the trend line. Looking at this non-abuse and neglect category as the primary reason for removal, and you could see that this trend has been increasing. Again, starting in 2019, it was about 28% or so, and right now you've got over a third at 35%. So again, this trend is increasing, and it's not due to abuse and neglect. All right. So now I'm just going to summarize what I've just said and what we learned through this work group effort. That placement instability, the majority of it, not all, but a lot of it, is driven by older youth. They're coming in with higher levels of needs. They have histories of running away. It's not as common to place them with relatives. That you've got this pattern, at least a chunk, a third, are coming in for non-abuse and neglect reasons. And we've also got this increase into small, but a steady increase in placing these particular children and youth in residential and group homes. So after having many discussions with the Leading for Results members and then them taking this information out to the areas, having stakeholder conversations, everybody got really interested in, okay, if these non-abuse and neglect categories is a big chunk of why youth are coming in or children are coming in, and this is very common for them to experience placement instability, we really need to understand why. Why are these non-abuse and neglect reasons happening? And so what we see here is almost a half, when we dug into it and disaggregated it, that about half were due to child behavior problems. The second reason was caregiver inability to cope. I also want to note running away was about 8%, And while this is only state fiscal year 23, these are fairly consistent trends for this kinds of removal reasons. The other point that I want to make on this slide, and if you can't see it, I just want to draw your attention to it and highlight it, is this 3% that are actually being removed from their families because they're not attending school. So just want you to sit with that for just a moment. And they're being placed in a foster care system for truancy. So even though 3% is small, it is just something to sit with and to note about this data work. The next slide I'm going to show you is the 5-year trends of child behavior problems when this is the primary removal reason for this placement instability group. And what you can see here, again, is the 5-year trends. And this has gone back and forth between a little less than half to a little bit more than half of the placement instability group. It's trended down a little bit this year and to 44%, but it's been fairly consistent over 5 years. The next trend I want to show you is the caregiver inability to cope reason in this placement instability group. So it started at 8% in 2019, but by the time we are here in state fiscal year 2023, it's at 26%. So this has steadily increased and continues to go up over the 5-year period. Okay, the next part of this story then is just to show you more directly the differences between the placement instability group and the more stable children and youth that come into Kansas system. And this reason, these non-abuse and neglect top reasons. So you can see this, and even if you can't see all the details, I'm hoping that you can see the drastic difference between the two trend lines. The orange represents children and youth that come in for this reason, child behavior problems, not abuse and neglect, but they're more stable, and that is around 11, 10%, and that's stayed fairly consistent. But for youth, mostly youth, and some children that come into your system for this reason and are bouncing around, this is almost half of that group is experiencing this particular problem for this non-abuse and neglect related removal reason. So there is a pretty stark difference here between those that are unstable and those that are stable. The last slide I want to show you is actually around abuse and neglect. So when the group that is bouncing in Kansas system and is experiencing more instability, when we look at the reasons for under abuse and neglect and those primary reasons for removal, this is what we see. The top line is physical abuse, and it's closer to 30%. But the other bars, in particular, I wanted to call out 3. You can see arrows, maybe not on the screen, but hopefully in the PowerPoint if you have access, are lack of supervision, physical neglect, and abandonment. Well, why is this important? Well, when you think about the age group that most of the placement instability is happening in, these are the kinds of things that probably are more indicative of service needs, like trying to control a teenager with some behavior issues. It may be hard to supervise. So from the perspective of those of us that work with child welfare, states, localities on a regular basis, these are the kinds of things that really can be addressed safely through strong upstream prevention efforts. The last slide that I want to show you related to our data work is around the requests for removal. And this was also something that we were looking at in the Kansas Leading for Results work. And you can see that Kansas, about 40% over time, and this trend again was also consistent, of all statewide removals were coming from non-child welfare, non-DCFS staff. And in some areas, you can see from the bar chart in Kansas, it's much higher than 40%. So why does that matter? Well, it matters from a readiness and a capacity standpoint. If you have child welfare not initiating those requests, then they haven't done a lot of the prep work that is needed to find the right placement, bring the child into foster care, and make sure that they can be stable. So the fact that other folks other than child welfare are making large percentage of removals is probably having an impact also on your system, the child welfare system in Kansas. And just something to note. Doesn't mean that some of them weren't necessary, but that's a pretty high percentage in our experience with other states. Finally, I just wanted to illustrate some of the ways that the Leading for Results work group members started to act on these data and the data that they collected directly from stakeholders in their area meetings. One of the things that, and we've organized these in what we consider key levers to make a pathway of change. So for example, education is very critical to this particular issue because you have a lot of folks that think foster care is something that it probably really isn't. And so one of the things that the group wanted to start doing is to create education materials to kind of educate folks about, well, you know, foster care really is mostly a network of volunteer homes, just regular families that want to help children in times of pretty intense need. And it's also designed as a temporary solution. So the fact that you've got older youth that are being removed for things that aren't abuse related and they're around behavioral health issues, most folks that volunteer to become foster homes don't think about that population as somebody that they would want to have in their home. And so that was one thing that the group wanted us to start to talk about, education strategies. And some of the areas actually did develop some communication tools that they started talking with their stakeholders. They also noticed that we needed to come together around practice, cross-system practice changes perhaps. And Secretary Howard also alluded to that. You want to have these meetings, these team meetings to kind of figure out ways to divert foster care entry. And so you'll see that. There may also need to be some policy changes. The front door is very wide in systems. Usually there may be a policy or a legislative solution to that, particularly if you have a lot of removals that aren't related to abuse and neglect. Something to consider. And then of course, we have to continue to resource prevention and create reasonable pathways to access that. And some of the interventions, again, that Secretary Howard mentioned, those are strong evidence-based programs, and I'm going to show you those interventions again in just a moment, MST, FFT. And I'll say what those are in just a moment because I know I'm using some acronyms. Okay, again, I just want to restate this and summarize it in a very succinct way. The problem of placement instability in Kansas is a complex problem that starts further upstream than the child welfare continuum. To really address it, solutions have to involve cross systems and community level stakeholders in addition to child welfare. And this is a wonderful opportunity to leverage prevention. Family First provides an additional fiscal avenue to stand up prevention. And there are also other avenues, Medicaid, that also has funding in it to stand up prevention, particularly around the particular population driving instability. So those are some of the three main takeaways. We also wanted just to share some of the survey findings that we conducted with the Leading for Results members a couple months ago, close to the end when we were getting ready to package all of this information and hopefully share it with the leadership. And we asked in a survey, you know, and the numbers still are small, but the members did respond, those that did respond, you know, if this is a cross-system problem and we need to coordinate and collaborate with other systems, how do you feel about that? Do you feel like there are challenges, or do you feel like that's a reasonable partnerships already. And what we see here is that the systems that we most needed to table to address placement instability in Kansas, behavioral health, courts, justice, substance abuse recovery, juvenile justice, those are the ones that the membership felt like they had the most challenges with collaborating. But you know what? That's not uncommon either in systems. A lot of times in large systems, it's easy to kind of focus on your particular area and work in what we might call silos. And so it really does take something like this, passion, a willingness to address this problem for these systems really to come together. And I'm excited to show you some national initiatives where that is actually happening in just a moment. So that's the conclusion of Leading for Results. The key parts of this work, there was so much more that went into this, but we wanted to highlight the main takeaways and the main process that we took to get there. A couple of more things I want to share with you on the national perspective.
Dr. Heaton,
And
if
then
I can interrupt you briefly.
Yes.
So if you don't mind,
Absolutely.
I'd like to go ahead and take any questions we have on this data. We're limited to about 12 more minutes before committee is over, and I want to make sure we have ample time for questions on the data that we have heard so far. So if you don't mind, committee, are there any questions currently for Dr. Representative Humphreys?
Thank you, Mr. Chairman. One statistic that stood out to me that I just wanted a little more information was when there was 3 or more placement moves in 12 months, 71% had a disability, if I understood that correctly. Could you break that out? Like what are we talking about there?
Yes, that's a great question. As I understand it, first of all, that 71% is based on half of year of state fiscal year 23. The percentages were not that dramatic in the prior years, although that was a good chunk. So that's just the first thing, caveat that I want to say about the 71%. That particular measure, as I understand it from the child welfare data team, includes things like behavioral health related disabilities. So it might include, and the child welfare data team can give you some specifics, but it might include things like active mental health, untreated mental health, right? So we know in juvenile justice populations that mental health and substance can drive criminal behavior. And if we can treat those things, we won't have so many children and youth entering systems like child welfare and juvenile justice. So that's the specifics that I can answer without going back to the data team and child welfare, and they can disaggregate that a little bit more.
Okay, if we can have a definition of disability somehow at some point, that would be great. Thank you.
Very good. Representative Carmichael.
Thank you, Mr. Chairman. Thank you, Dr. and Ms. Howard. I'd like to direct your attention to slide 24, which is the slide that discusses DCF and non-DCF removal requests. I represent people in Wichita. I note a wide disparity between Wichita, Kansas City, and the rest of the state in terms of how many referral requests originate from DCF as opposed to other sources. What might account for that type of a disparity from these two large metropolitan areas as compared with the rest of the state?
I can speak generally to what we see in other states. The specifics about unpacking that, the child welfare team in Kansas has unpacked this in more detail, so I know that it's available. What we often see in urban areas versus rural is resources. There are more resources a lot of times in metro areas or populations, and so folks feel like there are more options to get services up front, prevention services, and in more rural or frontier areas of states, that tends to be, the resources are not as available. And so folks think, well, we've got foster care, let's go ahead and use that as our resource. And folks do believe that foster care is a therapeutic intervention, and in the way that it was designed is not that. So I can speak, again, generally to what I've seen in other states, but the specifics about Wichita versus the rest of the state, I'm going to have to defer to child welfare to provide more information on that. I know that they have drilled into this more deeply, but it was not part of this presentation.
I'd look forward to hearing that information at a later time from Secretary Howard and her staff. Thank you, Mr. and Madam Chair.
Thank you. Dr. Heaton, can you further explain and provide the definition of non-DCF referral so that we know the other organizations making these removal requests?
That is a great question. I don't have the exact definition. As I understand it, it might include folks that have the legal authority to remove in Kansas. So the way that we see this play out in other states, and probably in Kansas as well, sometimes it could be judges, sometimes it can be law enforcement, but in Kansas, this non-DCF removals, to know the specifics of what that term and how it's defined, would again have to defer to the child welfare data team to define that more precisely based on your policy.
Thank you. Yeah, my assumption was that it had primarily to do with a court-ordered removal versus a DCF-initiated removal through the juvenile justice system, which is what we're trying to address. So, Chairwoman Kincannon.
Thank you, Chair Owens. Dr. Heaton, you mentioned that you're getting information data from DCF. Are you also getting information and working with corrections and juvenile justice in Kansas? And that's one question. And then my second question is, which systems need to be at the table?
Great questions. I'll take the first. In terms of looking at data from juvenile justice, we, in this part of this work group and our support of Kansas, did not. I think that's a great idea. And I can tell you why we didn't. Number one, we came in to focus on what we thought was the foster care problem. We were made aware of some early data that looked at the impact of Senate Bill, I think, 367. And so we did review those early reports. But juvenile justice specific data was not looked at. I do think that's a great idea. And I know in Illinois, the initiative that I wanted to reference, they did bring together juvenile justice and look at juvenile justice data as part of their behavioral health transformation effort. Your second question, who needs to be at this table to address this problem? Specifically, child welfare, we know that. They're already at the table. Juvenile justice, your courts, particularly the courts that oversee delinquency cases or juvenile justice and child welfare dependency cases, your behavioral health services, community providers that provide the kinds of services that are needed for these youth, like multi-systemic therapy service providers, like functional family therapy service providers, and Medicaid. We find that there are a lot of solutions in Medicaid, funding solutions that folks may not always be aware of. And when those systems come together in a coordinated, systematic effort to align policies, fiscal, and so forth, that's when we start to see change in this kind of a problem. And again, there's several examples at the end of the slide deck, and if we don't get to those, I've put them in for you to review as resources.
Thank you.
Thank you. Representative Howell.
Thank you, Chair. Looking at slide 17, under the primary reason for removal, the top two categories, it said for non-abuse neglect, it says child behavior problems is 44%, and then the second one is caregiver inability to cope is 26%. I'm just wanting to double check or understand. Obviously, if the child has significant behavior problems that could cause the caregiver to develop an inability to cope, are those being counted as separate categories, or are those overlapping categories?
The way that I understand these is that they are, I believe, mutually exclusive. However, I know in national data, sometimes these overlap. So when a caseworker or the person that documents this data, either at a hotline or maybe out with a family, documents reasons like this, they usually will have options to select, okay, what's the primary reason but you could also list some of the other reasons. So sometimes they overlap and sometimes they're mutually exclusive. I believe in this data they're mutually exclusive, but I can't say with 100% certainty without going back to the data folks at Child Welfare to clarify that.
All right, thank you. Further questions, committee? Representative Underhill.
Thank you, Mr. Chair. I have a question on page 17 as well. The meth use and manufacturing at 5% seems excessively high, and I don't see any other drug use, whether it's, marijuana, that sort of thing. And when we're dealing with, teenagers, that seems like that would be on here. Is that lumped in with child behavioral problems or if not, where is that? Or is the meth use manufacturing kind of lumped in as a drug use type line item, if you will?
Let me make sure I understand that question. Are you asking if overall drug use, like as a reason, like substance abuse perhaps in a parent or substance abuse in the child or youth, is collapsed into this meth use and manufacturing measure? Is that the question?
I was asking if the juvenile drug use is child behavior problems, or why meth use and not drug use or that sort of thing is individualized. And it seems like that meth use at 5% seems high when there should be possibly a category for other drug use or where those numbers might be.
Yeah, that's a really good question. So they are separate. So you can see here drug use, drug abuse parent. We also have a measure in the data drug use child. So this is actually a distinct category that Kansas had. We did not spend a whole lot of time trying to unpack that particular metric. So it could be, depending on what Kansas policy is and how you all define that particular measure, it may be due to a youth using it, but my guess is it's probably more related to the context of the home. But I can't say for certainty exactly what that measure is, but I can tell you that is different and distinct from some of the other measures that actually indicate drug use, like the drug use by the parent that's listed there.
Yeah, thank you. And I think you mentioned that there was a drug use, for the youth on here, and I don't see that. And I think that's where your question comes from, is the only drug use for the youth we're referring to is meth use, meth manufacturing. There's no other reference on this chart for any other drug use. And you mentioned that there was, so is there something missing on this chart?
Ooh, that's a good question. So the meth use, we don't know who is the user of that. It could be the home environment, it could be the youth, it could be the parent. That particular measure, it didn't have that distinction, who was the user of it. In Kansas data, there is an option to select drug abuse by a youth or a child. It was not either, it was zero or it was so small, and we could only fit so many percentages on the slide, that it would have been either way at the bottom or not present for this particular metric. So again, this is not abuse and neglect and placement instability. So there is a way to capture youth substance abuse in the child welfare data. It is not reflected on this bar chart either because it wasn't selected at high enough percentage to make it on the chart, or it was at zero.
That makes sense.
Okay.
That makes really good sense. Committee, further questions? Representative Owsley.
Thank you, Mr. Chair, and thank you for the presentation. It's always been my understanding that Kansas is one of the only states that removes for non-abuse neglect. And in your findings, do you know if that's factual or not? And if so, what do other states do with this population? How do they address the non-abuse neglect issue?
Well, I can speak to the fact, do states remove for non-abuse neglect? I can say it's not very common, but there are instances where states might remove for an alternative or a differential response. I do not believe Kansas has that option, as I understand it. So it's just different from an investigation, but a lot of times the process in which, or the business process in which that happens is similar to a child abuse and neglect investigation. So a worker will go out and make an assessment. The idea is not to make a finding of abuse or neglect, but to assess for services. There are instances in states where a worker may remove a child and it came in as an alternative response. So technically it might meet the standard of an abuse and neglect in Kansas, but we don't administer an investigative response. So we've seen that. There are also instances where you might have law enforcement or a court order a child into custody, and there's a variety of reasons that might happen. So that does happen in other states. I can't speak to how much higher Kansas does this non-abuse and neglect, but I did think that 30% felt unusually high based on what we see in other states. I hope that answers your question. It does happen in other states. And the second part I wanted to answer, what do other states do? I think the more that you look at the outcome in the research when children are in foster care for longer periods of time, so it's not temporary, right? It drags on over 12 months or even years. And the research, cumulative research on that kind of scenario, usually, especially when they're placed with a non-family member, usually has poor outcomes. And so when states really start to think about that, they do try to create cross-system options. So some of the things that you are actually trying in Kansas are things that are being used in other states, like bringing together like a teaming approach with justice, with your court, having family team meetings to try to divert placement, either in justice or child welfare, because the reality is we don't want to overuse either one of those systems unless they're really needed for the way in which they are designed. So coming together and in a cross-system teaming approach, making sure you have the right services like an MST and FFT and scaling those are the kinds of prevention services that actually can make a difference in both those systems. For minor crimes that are in truancy and things that kind of out of control teenage behavior, those interventions are designed exactly for that and are effective in the evidence.
Well, thank you very much, Dr. Heaton. I know we're already about 5 minutes past when we're scheduled to end. Maybe if you have anything specific, take 2 or 3 minutes just to wrap it up. If there are some specific slides here towards the end you wanted to touch on briefly.
Just maybe a couple. Let me just run through here real quick.
I wish we had another hour or two with you, but unfortunately we're limited.
I just wanted to show this, that I got really interested as a researcher in teenagers coming into foster care, particularly when we know that's one of the hardest groups to place in a congregate setting. And this is actually a problem across the country right now. And I'm showing you national data. And you can see here about, and I will say this, across the country, and this is true in almost all states that I've looked at, about 20% of removals are this teenage population. And then when you really start to think, well, why in the world are we bringing teenagers into foster care when we know that they're the hardest to place? And you also have to think about developmentally where they are. They're not as vulnerable as some of the younger ones that we need to really think about safety around. And you can see that this child behavior problem, caregiver inability to cope, those are pretty substantial percentages. That neglect category, when you think about that in a national level and the data that we're looking at, that's really hard to unpack. But I would argue that neglect for teenagers is probably indication of some other kind of need, particularly when we think about the access they have to, technology to help themselves out, or just where they are developmentally. So that's one thing I'd like to say. When we actually refine it to teenagers going directly into congregate care, it's indicated as a reason almost half the time. So we've got this group of teenagers throughout the country right now that keep coming in, and they're coming in for these behavior problems. And one would argue this is not really abuse and neglect. This is an indication of service need. And so the last thing I just want to to show you, just take a look at this slide when you have a moment about the implications. The foster care system, as I mentioned, it's really not designed to be a therapeutic service intervention to support complex mental health and behavioral health needs, particularly for youth. You don't have homes that want to take acting out teenagers usually. And even then, when you have group settings, those really need to be tailored to provide treatment and not end up just, we don't have nowhere to place, so we place youth in these settings. And then they stay there, and the outcomes are really not good when they age out of care from those kinds of institutional settings. So there are also, just closing the loop on what Secretary Howard said, these are the kinds of interventions that really can make a difference, particularly when you take Title IV prevention dollars and you braid it with Medicaid, which states are doing for Family First. You can really have a lot of options to expand your service array for this population. And finally, I just wanted to mention three national strategies, all initiated at the governor level. First, Illinois, and you can see all about this here. And this is a complete transformation that actually started with displaced youth, youth staying in offices and we couldn't find anywhere to put them. But it also started with, we've got all these teenagers that have behavioral health needs and we don't know what to do with them, so we'll call child welfare. The second, very similar, Virginia started around the same time Illinois did, and it was actually their state and their local departments that raised it, saying, we don't know what to do. We've got all these displaced youth, but it's all connected. A lot of this is related to behavioral health needs or developmental disabilities, and parents just don't know what to do. And even when these kinds of children needs come in the system, it's very hard even for the child welfare system to serve them in the way that they need without having these other systems involved. And then, of course, Ohio Rise, which is an integrated coordinated care using Medicaid for intensive behavioral health needs. And so finally, I just wanted to share our information here. This was a project supported by the center. You can see the center liaison, all states have one, and listed there, and also myself if you have any follow-up that you would like us to do. Please feel free to reach out. And thank you so much for the opportunity to share this on behalf of the Leading for Results work group.
No, we thank you very much for your time and your willingness, Dr. Heaton, and also for your time, Secretary Howard. Really appreciate you guys. This just helps us further recognize the significance of the issue that we're dealing with when it comes to out-of-home placements for reasons other than neglect, and possibly identified some of the reasons that maybe some of us already knew, but some things that we need to address. So committee, thank you guys very much for your indulgence. I know we're running a little bit late here and there's another committee, so we will be adjourned. Thank you.